Is a bulging disc in the neck serious? It's a great question to ask and to consider, especially if you've been diagnosed with a disc herniation or a bulging disc in your cervical spine with an MRI report, an MRI study. So in this video, I'm going to address and answer the question, is a bulging disc in the neck serious? Hi, I'm Dr. Walter Slubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to stabilize and strengthen your back. Like this, you can bend, move, and lift without pain limitation and enjoy the things you want to enjoy in life. So if you want these tips and strategies, be sure to subscribe right now on that red button below. Tap on the notification bell. Like this, you don't miss out on the video updates that I put out on a weekly basis. As well, if you just subscribed, let me know in the comments below and I'll personally reply back with a thank you. So when does a bulging disc in the neck become serious? First of all, you need to understand that a disc bulge means there's an injury to that disc. It's no longer intact. There could be annular fiber tears. There could be a disruption in the annular ring of the disc. There could be a bulging into the actual openings where the nerves come out of, or even posteriorly where the spinal cord is. And that is what makes a bulging disc in the neck a serious situation, whether it's symptomatic or asymptomatic. So symptomatic with pain and symptoms or asymptomatic. Either way, it's describing and showing that there's a structural disruption in the disc and possibly even in the alignment of the spine. So it can give us a lot of information when we start to dive in clinically and looking at all the data, such as MRI reports, clinical status of the patient, their abilities, and also their x-ray reports. So one of the most common symptoms that makes a disc bulge a serious situation in terms of someone's lifestyle functional limitations is serious or severe pain in the neck. A disc injury will cause a tremendous amount of inflammation and inflammatory reaction, especially during the acute early stages of the injury. So because there's a flood of inflammatory chemicals, it will cause immediate pain in the local area. If those inflammatory chemicals begin to disperse, then the pain becomes more diffuse around the entire neck area, possibly around the shoulders, and maybe even in the upper back. So that's one of the situations where disc injuries in the neck can cause some problems. The other issue is when a disc will go posterior lateral. It'll begin to irritate the nerves that come out from the side of the spine over here. Especially in the neck, those nerves go down to the arms, into the hands and fingers. So it can begin to cause radicular symptoms, or symptoms into the arms, forearms, hands, and fingers. Shooting pain down the arms, tingling or numbness sensation, pins and needles sensation. If that becomes a chronic problem, that means there's chronic irritation on that nervous system. Another problem with disc herniations or disc bulging in the neck is if the disc goes posterior. So if disc herniates posterior, then that will begin to cause central canal stenosis. It'll begin to impinge or compress on the spinal cord. That can cause a whole bunch of problems, especially if that area of the spinal cord is going to important organ systems like the lungs or the heart or the stomach, because all the nerves from the brain and brainstem travel through the cervical spinal cord before it gets to the rest of the body. As well, if there's a cervical myelopathy due to disc herniation and a central canal stenosis in the cervical spine, it can even cause problems with walking. That's when it becomes really, really serious. Another thing to consider when it comes to disc bulge in the neck is if there's any other associated problems with the spinal bones or the position of the spinal bones or the alignment. So if you look at the spine over here, we know that from the side, the neck needs to have this nice circular approximation or shape. From the front, it should be straight. Well, if there's a disc bulge or herniation, it's already an indication of disc damage or spinal positional problems, most likely. So if there's a loss of curve or a kyphosis that led to that disc bulge, it's possible there can be some ligament damage or instabilities that can cause more issues as well in irritating or damaging the spinal cord and also the nerves. I've seen cases in my office where people have had double surgeries, where they've had surgical plates to fuse and stabilize surgically with an operation the spine, both in the front and the back. And of course, those are situations we want to help prevent with our patients. Once you get to a surgical situation, then conservative management is not going to be helpful at that point. So what we want to do in our office is find out where the structural abnormality is of the cervical spine in relation to the rest of the spine through our analysis, and then see if we can apply some corrective non-surgical methods to position the spine back into a better, improved position, take the pressure, the abnormal load off those injured discs, give it a chance to properly heal in the right area. By doing so, the inflammation diminishes, The nice thing about that is the pain begins to come down. The irritation on those nerves begins to diminish. Any pressure on the spinal cord begins to diminish. In the result is that the person begins to improve their quality of life, quality of health, and their abilities by correcting the alignment of the spine. So I did get a lot of questions on my channel or by email of how to find a corrective care chiropractor that does similar work that we do. I'm trained in chiropractic biophysics, also certified. If you need help with that, just comment in the comment section below that you'd like to be directed to a corrective care chiropractor in your area. And what I'll do is I'll send you a directory of chiropractic biophysics trained and certified doctors that you can search in your city area. Hopefully you can find someone close to you. If you have any questions, do leave them in the comment section below. I do my best to answer your questions, especially in the first couple of days after the video is uploaded. As well, if you're looking for exercises that may help with cervical radiculopathy or numbness tingling into the arms, here's a great video that I posted some time ago for exercises for cervical radiculopathy that sometimes can be related to a bulging disc in the neck. So go ahead and check that out right now.